Dr. Rang, we've spoken so much about patients, about children, everybody. Now I have to ask you about the healthcare of doctors. You know, you read in the paper sometimes that doctors are under severe pressure, and some have even committed suicide. You know, because now tell me, what is it about doctors falling ill like this, having mental pressure that they can't cope? Can't doctors see for it? I mean, it's a very basic question that a doctor should be able to tell, that he's or she is slipping into some kind of a depressive state and needs help. Do doctors hesitate in seeking help or hesitate in accepting that there might be something wrong?
So, very pertinent question, and I'm glad we are getting a chance to discuss this. But I'll divide it into two parts. One is through your MBBS and your MD and residency days. Now, obviously, during this time, especially your MBBS and your MD, the curriculum is so robust and so stressful along with the classes that you have to attend. I think that pressure of the exams, like you have your board exams, etc., this is probably multifold, and there's so much at stake, especially like again what Dr. Gupta was saying about that peer pressure, that everyone wants to do well. So I think it is more of actually inculcating that mental health chapter in all MBBS and medical students, so that they can actually understand what is mental health, and also have that service, that if someone wants to reach out to someone, they should have that accessibility so that they can get counseling, they can get therapy, and so on and so forth. And I really feel that is lacking in the current Indian medical institutes that we have.
You must have done your PG after
Yes.
several years after Dr. Gupta
That's
has
right.
done. Did you have that kind of in your medical college? Was there anybody reaching out?
No.
Nothing?
We had our fixed academicians, our teachers,
That's it.
professors, batchmates, etc. But I don't call anything being so accessible like the way I feel that it should be with all these strategies, these tragedies that we are hearing. Also, now coming to the flip side, now even with practicing doctors, I think one thing that the nation needs to understand is that we are not superhumans. And it is not possible that you called us at 10:45, and if we didn't pick up, then it doesn't mean we don't care about you. It just means we might be sleeping, or it means that we might be in the middle of dinner or something important. So I think it's also that expectation that where, especially in a country like India, like abroad, I have a lot of friends in the US and the UK, and post 5 p.m. they are off for work. But here, I think it's also the immense amount of passion that we work with, that even if it's 8:30 and if you're sitting with your own family and someone calls you, your family also wants you to pick up, because a 1 minute call that you have with them, it's probably going to put them at ease and help them out the entire night or maybe a day. So I think that empathy and that passion together is what fuels our fire, but I think that will eventually take a toll on it.
Yeah.
And I think accessibility to the right therapist or somewhere where you can be heard, I think is critical again. And obviously a very important work-life balance is something also that all doctors should maintain, having hobbies or playing a sport. I know, easier said than done,
Yeah.
but that is the need of the hour.
Dr. Gupta, I'm sure there is no work-life balance that you have. You, as a pediatrician, I'm sure you need to be available, or you are available to your patients.
I will say that I'll spoiled my whole life if I try to follow, and I didn't follow even 1% of that, and I paid for that, right? And and all life, not lifestyle, lot of problems. But what I would like to say, like right from the MBBS, and first of all, I totally agree with him. And just I want to add extra that 60% of curriculum should be removed from medical science. Like for a MBBS doctor, why I need to find out what is happening in the cell under the microscope when I am not going to chase histopathology as my curriculum, right? So these type of unnecessary burden over a brain is a brain, right? It has got limitation. We should try not to over test it. So in India already we are overpopulated. So for one seat there are 25,000 candidates.
Yes.
over and above, you're giving unnecessarily, which are not going to, unnecessary curriculum. It's 60% is just rubbish. 30% is carrying history. Just you want to carry the legacy, but doesn't burden the things by giving the medical history as a 30% of the curriculum. Secondly, there are something super specialists need to know. Why you are telling the MBBS person to cram up the things which doesn't have practical implication for at least next 10 years for him. So my feeling is that many of the things, because my other son is doing MBBS, he is in final year, he's
reduce
a
the
very
workload.
mature guy. He's, I found that he's much more maturer when I was if I compare myself
When you
with
were studying.
when I was in final year. But almost 60% is the curriculum should be removed immediately.
Right.
The professor should now come in the public domain and should try to reduce the burden of the whole society, medical society.
Dr. Dang, you were saying about how, in America or in the UK or in any of these Western countries, patients don't call up the doctors in the middle of the night and all. I'm sure both of you get calls. And I mean, we are all guilty of doing it. I wouldn't say just, the random people are, even I'm guilty that I could have waited till next morning to call up my doctor, but I need to know now. And especially I think, Dr. Saab, I will say to you, because जब बच्चा बीमार पड़ता है तो mother won't wait अगले दिन के लिए, उसी वक्त डॉक्टर को फ़ोन करेंगे. And pediatricians in India at least are always available 24 hours. I'll ask you, Dr. Saab, and then I'll come to you, Dr. Dang.
Yeah. इसके दो एस्पेक्ट्स हैं. पहला एस्पेक्ट, आई शुड नो कि व्हेन आई शुड सीक ए डॉक्टर इन ए क्लिनिक. Second, when I should seek a medical facility. So, in an emergency, suppose आपने बात की कि pediatricians 24 hours 365 days आपके कॉल पे रहते हैं. I totally agree, because पैनिक होता है बच्चों को लेके, पैनिक होता है. एडल्ट अपने लिए एब्जॉर्ब कर लेता है, बेचारा बच्चे को देखते हुए लगता है उसको पैनिक कर सकता है. इसमें आपको आइडिया होना चाहिए कि अगर ये लाइफ थ्रेटनिंग कॉम्प्लिकेशन की तरफ जा रहा है या मेजर क्राइसिस की तरफ जा रहा है, यू नीड मेडिकल फैसिलिटी, बट यू शुड गो टू ए हॉस्पिटल एंड एमरजेंसी में आप दिखाएं, रेदर देन कॉल करें फ़ोन पे. आप मेरे को अगर कॉल भी करते हैं रात को मिड ऑफ नाइट में, मैं कुछ ऐसी चीज़ बता दूंगा, हो सकता है आपका टाइम टल जाए लेकिन कॉम्प्लिकेशन ज़्यादा कॉम्प्लिकेट हो जाए और आप मिस कर दो बस को, राइट? जिस प्रॉब्लम ने आपको रात को 3 बजे उठा दिया है, इसका मतलब आपको हॉस्पिटल जाना चाहिए. यहाँ पे मैंने कई बार देखा कि सर आपका हाथ लगता है, आप मेरा बच्चा बिल्कुल ठीक हो जाता है. तो हम सुबह से आपके क्लिनिक का वेट कर रहे थे और कई बार मेरे क्लिनिक में बाहर बेचारा 2 घंटे बाद नंबर आया और मैं उसकी कंडीशन देखता हूँ तो मेरे को फील सॉरी होता है कि मेरी असिस्टेंट ने उसको पहले क्यों नहीं भेज दिया. 2 hours भी सफिशिएंट होते हैं. सो आई मीन टू से दोज डिजीजेज विच डजंट गिव यू टाइम, गोल्डन आवर में उनको डॉक्टर के पास जाने की जगह हेल्थ केयर सिस्टम में जाना चाहिए. क्योंकि हेल्थ केयर सिस्टम अच्छा नहीं है हमारे पास. प्राइवेट है 80%, 20% गवर्नमेंट का. गवर्नमेंट में भीड़ लगी हुई है, लाइन लगी हुई है, कोई ठीक से पूछता नहीं है. पूछेगा कहाँ से? 40 पेशेंट है, कहीं ना कहीं तो मिस करेगा ही डॉक्टर. तो वो अब उनका ट्रस्ट ख़त्म हो जाता है कि सर वो तो देखता ही नहीं है ठीक से. अब इतनी लंबी लाइन लगी हुई है. अगर आप यूके में देखें, आपको अगर NHS में 44 आवर्स वेटिंग टाइम था.
करेक्ट.
हमारे यहाँ आपको अगर 44 आवर वेटिंग टाइम का होगा तो आप फ़ोन करने लगोगे, या तो किसी मिनिस्टर का फ़ोन आ जाएगा, किसी हॉस्पिटल में किसी बड़े उसका फ़ोन आ जाएगा, यार जाके देख यार वो बेचारी 1 घंटे से वेट कर रही है. हमारे यहाँ जिसके पास मनी है वो 1 मिनट नहीं वेट करना चाहता. जिसके पास बेचारे के पास रिसोर्स नहीं है वो डिजीज सीवियरिटी होते हुए भी 1 दिन तक वेट कर रहा होता है. राइट. ये डिस्पैरिटी जब तक नहीं ठीक होगी तो तब तक हमारा काम आगे नहीं बढ़ेगा. हमें इंडिविजुअल लेवल पे केयर देनी पड़ेगी. राइट. जैसे मेरे को अगर टेस्ट करवाने हैं, मेरे पास कोई सिस्टम नहीं है कि मैं इस सिस्टम में जाऊंगा मेरा टेस्ट हो जाएगा. मैं डॉक्टर डैंग को इंडिविजुअली फ़ोन करूंगा कि यार डॉक्टर डैंग सर मेरा करा दो प्लीज़ काम.
एग्जैक्टली.
जब तक वो मेरे की जगह हमारा नहीं होगा तब तक इंडिविजुअलिटी और इंडिविजुअल फ़ोन नंबर्स की इम्पोर्टेंस रहेगी. हम कितनी भी बात कर लें, बड़ी बड़ी बात करेंगे, वो अगर अल्टीमेटली हमें जब काम करवाना है
Yeah.
तो हुक एंड क्रुक से हम काम कराएंगे, और जो इंडिविजुअल नंबर हुक एंड क्रुक का ही एक पार्ट है.